I want to talk to you about your lymphatic system. And now your lymphatic system, and there's such a thing called like a lymphatic pump or whatever. It's not actually a pump. So really, to get the lymphatic system moving, you got to get up and move. Um, and so there's a reason in the hospital or whether it's a rehab clinic that they try to get people up and get them moving. They're trying to get this lymphatic system moving right now. The vascular system is moving because the heart's sitting there pumping. Is it doing it as efficiently if they're laying down or sitting in the chair? Of course not, but there's going to be some vascularity that comes to it, and the lymphatic system is secondary to it. They run parallel to each other. They have cross-linking fibers so the lymph can go over and the blood can flow over. So those things happen. So here's a few ideas to get this going. Walking is a very good thing to do when you have lymph that needs to be moved. And why would you ever need that? Well, sometimes swelling in the leg isn't vascular at all. It's lymphadenopathy, or you get lymphatic tissue that goes in there. I mean, if you ever really like squeezed a finger, or maybe had a cut around it, and there's other stuff that comes up. There's interstitial tissue fluid that comes out there, but sometimes it's lymph that comes out. If you've ever been cut or there's a scar, I mean, the white stuff in there, that's all what can be pus. But pus is part of the lymphatic system. Lymphatic system is systemic throughout your entire body. So again, swelling in a lymph node, a lymphedema, lymphadenopathy, and it can cause chronic pain. You can get that with chronic fibromyalgia, joint pain, and lymphadenopathy just means the lymph isn't moving at all. So what would you do? Well, you move. Do you need to go run a marathon? Absolutely not. Do you need to do something high intensity? Absolutely not. You just need to get moving. But sometimes there's lymphatic massages or moving the body around and moving that lymph to move it along. So in the world of kinesiology, there are lymphatic tissue that they've identified that are known as neurolymphatic. So, for instance, if you do a lot of leg work or you do abdominal work, and maybe you've never done squats before, so if anybody's ever done even like junior high, they made you do a squat jump or something like that, the next day your butt hurt, your legs hurt. Well, that's lymphatic tissue. You did a muscle that was not used to moving. It broke down. It said, I am inflamed. I need help. And so you get soreness in that, and that lymphatic tissue and lactic acid is hanging out in the lymphatic tissue. Well, the lymphatic tissue from the legs and the abdomen dumps into another vein that's called the hemiazygous vein. The hemiazygous vein then carries it to the back end of the heart. The heart has, so remember, lactic acid hurts. At the back of the heart, we have an enzyme that's called lactic acid dehydrogenase, which will convert lactic acid to something useful again that you can make energy with called pyruvic acid. But you got to move to get it there. So sometimes lymphatic massage does it. So if you ever seen an athlete, before a game or a race or something like that, they warm up. But more importantly, because they're competing at the highest level they possibly can, they're going to do a cool down. That cool down helps move that lymphatic system around. I'm more excited about an athlete that actually does a cool down properly than one that just says, "Okay, I'm good, I'm done." But what if you can't move? So there's other ways to do it. You can drink a ton of water. You can get into an infrared sauna. That's the reason why we have infrared saunas, to help the lymphatic system go around. There's certain B vitamins or certain minerals that can do that to help and support the lymphatics. So does, let's say, even a ketogenic diet or a high-fat diet, because the lymphatic system, for the most part, is fat. So we give essential fatty acids. That's why we have them and sell them. Is that I want to get as much fat into this lymphatic system and get them moving and doing things. Even if they're sick, let's say they have the flu and it's coming out both ends, I still want them to get up and maybe walk up and down the hallway 4 or 5 times and then go lay down again, because rest is important. But get those things moving, get that fluid going through there, and get to go. So in the tissue, you have the spleen, which is a lymphatic tissue. You have the thymus, it's back behind your breastbone here, that's a lymphatic tissue. You have all these lymph nodes that are lymphatic tissue. And so at some point, everybody's had a lymph node, whether it's on your neck or somewhere that's probably swollen. That's just telling you that the immune system is having trouble, that are getting along. Now, one of the best things that we can check to actually check lymphatics is something called whole body thermography. One of the other things we run in our office, because it picks up these, is there any inflammation sitting around the lymph node? Is that lymph node for women related to any breast tissue? Is that lymph node for men related to any prostate issues that are going on? Is that lymph node for everybody else related to any other tissue that's going there? Now, some people treat lymphatics not only with lymphatic massage or there are ways to do it. Everything should be going toward your heart, by the way, if you're going to do anything like that. So there are the rollers that you have, and some people roll and roll up and down the legs or the spine. You move it up, down, up, down. You're not pushing it toward that big vein and getting it toward the heart. So little shortcuts that can make a huge difference on it. So foot baths, I used to run some foot baths. I spent a lot of money sending foot bath, we'll call them tissue samples, because you have water samples and then you have people put their feet in and the ionic and everything goes through. And I sent them off to Texas A&M, and while there was some human tissue and we'll call it infiltrates and things that, whether it's a toxin or something that would affect the immune system or lymphatic system in there, it wasn't enough for me to go, oh my gosh, that made a huge difference, and it wasn't like if we did one, somebody that came in that was extremely toxic, or let's say they worked, I don't know, in metal work, or they just got done um, uh, staining an entire deck and they didn't use anything on their hands or their mouth or pesticide or whatever. It wasn't coming out of the tissue. So I don't see anything clinical that's beneficial. You feel better if you feel better taking them. I'm not gonna say no or poo-poo it. I just don't have any clinical data or any proof that's been run in the scientific world that says, hey, these are great. So we want to quantify if something's good or bad, and that's why I ran these tests. And I didn't see over 100 people really a huge response, but we do see when we see the lymphatic system or what we can do with it, or when we suggest, hey, I see these lymph nodes that are or you're not moving in your lymph nodes in a whole body thermography, let's do this. And we can see that respond in a few months. And so we're talking about if somebody really wanted to do the foot bath testing or anything like that, they're going to have to spend a couple $100,000 to get a really good test. And then they can't be the only tester. That's a conflict of interest that goes along there. But in the medical world, we have, cardiologists and endocrinologists and hepatic specialists, liver specialists. You don't really see it like a lymphatic massage MD. It's not out there. You don't see foot bath doctor MD. It doesn't mean that they can't help. It's just that they're not out there. And if there has been a lot of money that's put out there, it's just not as efficient as I wanted to be for some of these less potentially effective. I think you moving, you eating the right way, you eating hydrated, you moving your lymphatics, even if it has to be by you or by a friend, and then if push comes to shove, make sure there's a whole body thermography that you're able to see and to make sure that everything is working well, and those lymphatics is much more effective than just doing a foot bath. And I'm again trying not to be mean about that, but there's things you go get a rebounder. You can go up and down the stairs. If you have trouble with ambulation, maybe you broke a hip or a leg, and you've got a walker. Even moving and getting in a walker, even a few minutes, a couple times a day, is beneficial to the lymphatic system. Much probably be even better than um, you know than a foot bath. So I just want to throw that out there, and there are things to do, and that's why we like to use um, diet, nutrition, exercise, and at times the use of whole body thermography to see what the lymphatic system is doing. And by the way, that's the only device in the world that I know of right now that actually can check the lymphatic system. I'm Dr. Alan Trites.